Hello again and welcome to my YouTube channel. Today I'm going to be talking to you about OCD, Obsessive Compulsive Disorder in children and teenagers. My name is Tracy Maxfield. I'm a retired nurse, author, peer specialist and staunch stop bullying and mental health advocate and educator. So just a little bit of housekeeping before we proceed to talk about OCD. Please, if you look at the button below, consider subscribing to my weekly YouTube videos. Also check out my website www.tracymaxfield.com for up-to-date information about mental illness and bullying, what I'm doing, and also information about my course and my monthly newsletter. So, obsessive compulsive disorder in children and teenagers. Did you know that it is actually the fourth most common mental disorder diagnosed in our kids? And usually it affects probably 1 out of every 100 children or teenagers. What's interesting is no one really thought that kids could have OCD. They thought maybe it would start in adolescence, but we know that children now as young as 4 to 5 years old actually show signs and symptoms of obsessive compulsive disorder. It is a very consuming, stressful and challenging mental disorder. Usually it does not exist in isolation. Kids who have obsessive compulsive disorder can also have an anxiety disorder, could also have a major depressive disorder, ADHD, Tourette syndrome, hoarding disorder, eating disorder. As I said, it rarely exists in isolation, and as I describe the signs and symptoms and the risk factors, I think you'll have a better understanding. So what we have found is that there is no single definitive cause of OCD. However, researchers do believe that biological factors plus family history and genetics and past strep infection all may play a role in a child or teenager developing OCD. For example, 20% of kids with OCD have a family member. It can also be triggered by a stressful event such as the death of a loved one, a divorce, birth of a sibling, death or loss of a pet, transition to a new school, a new community, or even a new class. Now, before I go on, I'm sure some of you were going, wait, back up a minute. You mentioned past strep infection may play a role. What's interesting is in the early 1990s, they found that many kids who had just had a streptococcal infection suddenly developed obsessive compulsive disorder. And after a lot of investigation, they found that this specific type of obsessive compulsive disorder caused by strep goes by the acronym PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder associated with strep infection. Now, the good thing is that when treated with the appropriate antibiotics, the actual OCD symptoms, the motor disorder problems, the tics, etc., all disappeared. So it's worth mentioning, because if this OCD comes on very, very suddenly and unexpectedly, and your child or teenager has just dealt with maybe strep throat or something, it is worthwhile just checking it out with your physician. Now, we know that, as I said, OCD, very difficult. The kids get so stressed because they know what they're doing. Wrong isn't the word, but they know what they're doing is not normal. But they have the compulsion, they must keep doing it, and they become very embarrassed, confused, and even fearful of their obsessions and of the compulsions or the rituals that they do to manage the obsessions. And the more tired and stressed they become as they try not only to conceal it, but even sometimes to stop the compulsion, what we find is that their rituals are exacerbated. Sadly, it translates from their home life into their personal life and into their school life. And many children and teenagers with OCD have become the brunt of many taunts and jokes at school, and becoming a victim of bullying actually is extremely common for the child or teenager who has OCD. So yes, it is a very challenging disorder. So obsessions are persistent, disturbing worries, fears, anxieties, doubts that the kid just cannot stop thinking about. Even if they know that they don't make sense, they still feel anxious about them, and they continue to ruminate and perseverate and fixate on the obsessions. So obsessive thoughts and fears may include, right, that they or someone else will get sick and may die. They've said a bad word, had a bad thought, or made a mistake. Someone or something is dirty or contaminated or has germs. They have broken a rule, they're bad, or they've sinned. Something is lucky, unlucky, good or bad, safe or unsafe. Something is straight, even, or placed in an exact way. Compulsions are the rituals or repeated behavior the child or the teenager will do to make sure that things are clean or safe or even or in order. The rituals, they believe, have the power to prevent the bad things from happening from the obsession, and they believe that doing the ritual or compulsion is the only way that they can feel everything is okay, and that they're either protecting themselves or protecting others. Now, ritualistic behaviors can include things like obsessively washing hands, or cleaning, repeating a word or a phrase, tapping or knocking, or checking a door handle multiple times, going in and out of a doorway, having things in a certain order, erasing things, rewriting, redoing, rereading, counting to a good number, avoiding unlucky numbers, like not walking over cracks in a pavement, checking the door's locked, checking the light is off, rechecking homework. And you can imagine that these obsessions and compulsions just literally take over their life because they need to do it. And it may be that they're checking a door or a light 100 times, and that may be multiple times a day. And so you can see how this interferes in just normal daily life. So signs and symptoms that your child or teenager may actually be experiencing obsessive compulsive disorder. Trouble concentrating at school, enjoying activities, their trouble making their mind up, hypersensitive, become easily upset, frustrated, anxious, irritable, sad, seem unsure if they're okay. They take much longer to do everyday things, maybe such as dressing or washing or getting ready for school or leaving the house. They're often late for school and activities and completing homework assignments. They may insist that the parents say or do something in a specific way, such as set the table or load the dishwasher or unpack the groceries. And they will become easily agitated and angry if they can't follow through on their compulsions, if they can't make something perfect or something is out of place. Now I'm going to digress for a little moment. For those of you that may have watched The Big Bang Theory, Sheldon had OCD. His seriously, as a child, was more controlling of his life. As an adult, the way we perceived it on the TV, not so much. I think what you need to understand is that OCD can be all-consuming for a child. It can rob the child of its childhood, of his or her childhood. For an accurate and correct diagnosis of OCD, obviously we need a doctor's assessment, we need a psychiatric assessment, plus as a mum or a dad, list what you're noticing, their behaviors, what they're saying, what they're doing, when did it begin, how long has it been going on. And one of the most effective assessment tools actually to help diagnose OCD is the Y box BOCS, Yale Brown OC scale for children for OCD. And actually on the blog article that accompanies this, I actually have the website where you can go and take a look at this scale. So treatment for OCD is very specific. Cognitive behavioral therapy, CBT, so where we're enabling the kids to learn about their OCD, why they're doing what they're doing, how to face their fears, how to cope with them, and develop strategies that will help stop the obsessions and the compulsions. Family therapy, this is where we involve parents. They're taught how to respond to OCD situations and how to support the child or teenager without relying on compulsions and rituals. Medications, namely antidepressants, the SSRIs, have been found to be very helpful. And again, this is at the discretion of the psychiatrist. Medications would only be used in very, very severe cases of OCD. And then another therapy, which has been found to be extremely helpful, is ERP, exposure response prevention. So this is where, under the care of a therapist, and there has to be a very trusting relationship here because it's very difficult at the onset, there is repeated exposure to the source of the fear without using compulsions. And over time, this exposure therapy, the obsessions and the compulsions, the rituals diminish. It is found that those kids that have actually gone through a complete course of ERP, up to 80% experienced a significant reduction in OCD symptoms. Now, as I said, everything needs clear discussion with the healthcare provider and the psychiatrist, because if your child or teenager also has another existing mental disorder, ERP at the beginning may be too difficult for them to manage. That may be something that they would have to work up to. I think what's important to remember is things like hoarding disorder and OCD. It takes a long time because of all these pre-learned behaviours that have enabled the child or teenager to function, to remain in control, to feel safe, to feel protected. So as a parent, a guardian, a family friend, sibling, what can you do? I think the first thing is you've always got to be available. So be there, talk, listen. And the key word is listen. Be supportive, offer reassurance, be patient, show love. Be an active participant in the treatment. Also work through whatever strategies they've given you as a family. If medication is needed, take it. Be alert, obviously, for side effects of medication, and also see if the symptoms are getting worse or getting better and report accordingly. Also, if there's a pre-existing mental disorder, then treatment has to continue for that. You're going to encourage the child or teenager to work together as a family to deal with the obsessions. Another thing is spend one-on-one time with your child. Listen to their concerns, have fun, do a fun activity, follow up with the school, and also talk with friends, family, siblings on strategies on how to help the child or teenager as they're going through therapy. This is a long process. Adopt a holistic lifestyle. I'm very, very big on holistic lifestyle. So it's meeting the social, emotional, physical, spiritual, cognitive needs. So we're looking at healthy diet and exercise and activities and mindfulness and family time and relaxation exercises. And also, allowing your child creative expression and outlet to express what they're going through. So music, poetry, clay, Lego, art, journaling. Another thing I think which is very important is that OCD is extremely sensitive to stress and sudden changes in a routine. It can actually exacerbate the symptoms and the ability of the child or teenager to cope. And so I think a good thing is consider teaching deep breathing and relaxation exercises and strategies to deal with the stress as it happens, in a way to try and avert further problems with the OCD. And so on conclusion, I hope you found these tips helpful, and Actually, you may want to check out the Obsessive Compulsive Foundation of Metropolitan Chicago, ocfchicago.org. They have some amazing suggestions and tips on how to help a child or teenager deal with OCD. Next time, I'm going to take OCD one step further and talk about hoarding disorder in children and teenagers, becoming more and more common and can coexist with OCD. Thank you.